Welcome to my channel Instant Healthcare, where I share simple tips, expert advice, and motivation to help you live a healthier, happier life. As a trusted pediatrician, I understand your constant concern for your little one's well-being. Today, let's talk about anemia, a common blood condition that can affect children and toddlers. Don't worry, we'll navigate this together. This guide will equip you with the knowledge to recognize early signs and ensure your child receives timely care. Remember, you are your child's best advocate. By understanding anemia, you're taking a proactive step towards their health and happiness. Let's delve into the world of anemia and empower ourselves with knowledge. In essence, anemia occurs when the body lacks enough healthy red blood cells. These cells are crucial because they carry oxygen from the lungs to the rest of the body. Without sufficient red blood cells, the body struggles to get the oxygen it needs to function properly. These cells are vital as they carry oxygen throughout the body, providing energy for playing, learning, and growing. Imagine children running around in a park, attending school, or enjoying nutritious snacks. All these activities require energy, which is supplied by the oxygen transported by red blood cells. When a child has anemia, their organs and tissues may not receive enough oxygen, leading to various symptoms. These can include fatigue, weakness, pale skin, and shortness of breath. Parents might notice their child looking unusually tired or unwell, and healthcare professionals may need to check vital signs to diagnose the condition. Think of it like this. Imagine a busy bee trying to carry pollen back to the hive with weak wings. Just as a bee needs strong wings to fly and gather pollen efficiently, red blood cells need to be healthy and robust to transport oxygen effectively. It struggles to fly and deliver its precious cargo. Similarly, when red blood cells are weak or insufficient, they struggle to deliver oxygen to the body's tissues and organs. Similarly, in anemia, the wings of red blood cells are weak, making it difficult to transport oxygen effectively. This can lead to a range of health issues from mild fatigue to more severe complications. Understanding anemia and its impact on the body is crucial for managing and treating this condition effectively. By ensuring children get a balanced diet rich in iron and other essential nutrients, we can help prevent anemia and support their overall health and well-being. One of the most noticeable signs of anemia in children is pale skin. This paleness, often described as a washed-out appearance, can be seen not only on the face, but also on the palms of the hands, the inside of the lower eyelids, and even the gums. While occasional paleness might be normal, persistent paleness, especially when accompanied by other symptoms, warrants attention. Pay close attention to your child's complexion, and if you notice any unusual paleness, don't hesitate to consult your doctor. All children experience tiredness, especially after a busy day of play. However, children with anemia often display excessive fatigue and weakness. They may lack the energy for their usual activities, becoming easily winded and wanting to rest more frequently. If your usually energetic toddler suddenly seems lethargic, constantly wants to be carried, or avoids physical activities, it could be a sign of anemia. Remember, persistent fatigue is not normal and should always be investigated. Section 5. Shortness of breath. A cause for concern. Shortness of breath, also known as dyspnea, can be a frightening symptom, especially in young children. Since anemia affects the oxygen-carrying capacity of the blood, children may experience shortness of breath even with minimal exertion. They may breathe faster than usual or have difficulty catching their breath. Pay attention to your child's breathing patterns. If you notice rapid breathing, labored breathing, or shortness of breath during activities that they could previously handle with ease, seek medical advice promptly. Section 6. Cold hands and feet, not just the weather. Does your child always complain of cold hands and feet, even in warm weather? While this can be normal for some, it could also be a sign of anemia. When the body is low on red blood cells, it prioritizes sending oxygen to vital organs, often leaving the extremities, like hands and feet, with less blood flow, making them feel cold. If you notice that your child's hands and feet are consistently cold, even in a comfortably warm environment, it's worth discussing with your pediatrician. Section 7. Irritability and behavioral changes. Anemia's impact on mood. Anemia doesn't just affect a child's physical health, it can also impact their mood and behavior. When the brain doesn't receive enough oxygen, children may become irritable, fussy, and have difficulty concentrating. You might notice increased tantrums, difficulty calming your child down, or a decline in their attention span. While these behavioral changes can be attributed to various factors, anemia should be considered as a possibility, especially when accompanied by other physical symptoms. Section 8. Delayed growth and development. Anemia's long-term effects. In more severe cases, untreated anemia can have long-term consequences, including delayed growth and development. Since oxygen is crucial for cell growth and repair, a deficiency can affect a child's overall development. This delay can manifest as slower physical growth, delayed milestones, or even cognitive delays. Early detection and treatment of anemia are essential to prevent these potential complications and ensure your child thrives. Section 9. Causes of anemia, from diet to underlying conditions. Anemia in children can stem from various factors, the most common being iron deficiency. This condition can manifest in various ways, such as fatigue, weakness, and pale skin. Parents often notice their children appearing more tired than usual or struggling to keep up with their peers during physical activities. Iron is essential for producing hemoglobin, the protein in red blood cells that carries oxygen throughout the body. Without sufficient iron, the body cannot produce enough healthy red blood cells, leading to anemia. Other causes include a diet low in iron-rich foods like leafy greens, meat, and fortified cereals can lead to iron deficiency anemia. It's crucial for children to have a balanced diet that includes these iron-rich foods to support their growth and development. Parents should be mindful of their children's dietary habits and ensure they are consuming a variety of nutrients. Rapidly growing children, especially premature babies, have higher iron requirements. During growth spurts, the body's demand for iron increases significantly. Premature babies are particularly at risk because they have less time to accumulate iron stores before birth. Regular checkups with a pediatrician can help monitor and manage these needs. Certain medical conditions can hinder the body's ability to absorb iron properly. Conditions such as celiac disease, inflammatory bowel disease, or chronic infections can interfere with iron absorption. It's important to diagnose and treat these underlying conditions to prevent anemia. Chronic blood loss from internal bleeding or heavy menstrual periods can deplete iron stores. In some cases, children may experience frequent nosebleeds or gastrointestinal bleeding, which can lead to significant iron loss over time. For adolescent girls, heavy menstrual periods can also be a contributing factor. Deficiencies in vitamin B12, folate, or other nutrients can also contribute to anemia. These vitamins are essential for the production and maturation of red blood cells. Ensuring a diet rich in these nutrients or taking supplements as recommended by a healthcare provider can help prevent anemia. Regular blood tests and consultations with a healthcare professional are key to maintaining optimal health and addressing any deficiencies promptly. Section 10. What to do if you suspect anemia. If you observe any signs of anemia in your child, don't panic. Anemia can manifest in various ways, such as fatigue, pale skin, or shortness of breath. It's important to stay calm and take the right steps to address the issue. Instead, take these proactive steps to ensure your child's health and well-being. 1. Schedule an appointment with your child's doctor for a thorough evaluation. The doctor will review your child's medical history and perform a physical examination to identify any potential causes of anemia. 1. The doctor may recommend a simple blood test to check your child's hemoglobin and iron levels. This test will help determine if your child has anemia and its severity. 1. Incorporate iron-rich foods into your child's diet, such as red meat, fish, beans, and fortified cereals. These foods can help boost your child's iron levels naturally. Additionally, include vitamin C-rich foods like oranges and strawberries to enhance iron absorption. 1. If dietary changes aren't sufficient, your doctor may prescribe iron supplements. These supplements can help increase your child's iron levels more quickly. Be sure to follow the doctor's instructions on dosage and duration. 1. If an underlying medical condition is causing anemia, treating that condition is crucial. Conditions such as chronic infections, kidney disease, or nutritional deficiencies may require specific treatments. Your doctor will guide you through the necessary steps to address these issues. Remember, early detection and intervention are key to managing anemia effectively. By following these steps and working closely with your child's healthcare provider, you can help ensure your child stays healthy and active. Educate yourself about anemia and its causes. The more you know, the better equipped you'll be to support your child's health journey. Stay informed and proactive in seeking the best care for your child. With the right approach and timely medical attention, anemia can be managed effectively. allowing your child to thrive and enjoy a happy, healthy life. Section 11. A message of hope and support. Remember, parents, you are not alone in this journey. Anemia is a common and treatable condition. By staying informed, recognizing the early signs, and seeking timely medical advice, you can help your child thrive. With proper care and management, most children with anemia make a full recovery and go on to lead healthy, active lives. You've got this.